Hello, everybody. Good evening. It's Public Eye Life. I feel like this has been a really difficult week for many, many people. It's been a really difficult week around the world. For me, it's been an emotionally draining week because I feel strongly what others are feeling. And it started, of course, with the situation in America and the protests that broke out naturally. We're far away in Nigeria, but we live in the same world. And the kind of world we have built now, everybody is interconnected. So there was no way that you could avoid being affected one way or the other. But then after that, there was all the situation that happened in Nigeria concerning rape and violence and murder of young women. I've been doing this job for many, many years. And years ago on NTA Network, we did a whole month on rape. It was a very traumatic month. And this week felt a little bit like that for me. So much so I just had to go away because I was deeply, deeply angry. But then I reminded myself that, but for me, this is progress. There is some progress because when we did that show all those years ago, I think maybe it was 2006 or 2005 when we did that show, we couldn't get a single person to come out openly to talk about having been sexually assaulted or raped. We couldn't get anybody. They wouldn't talk. The way it was in the country at that time was that you couldn't talk, nothing could be done. So a lot of the conversations that were had were incognito. But look at us today, people are coming out, people are talking bravely. It's become such a big issue that even the people in positions of authority, including the police and politicians and all of that, are actually coming out to say, stop raping our women. So on some level, it is incredible progress in the period of like 10 years. So I would like to keep that at the back of my mind and keep that at the back of our minds as we go into today's conversation. The conversation today is going to be about viruses and violence because what happened, was that when the riots broke out, in America and around the world, then all of a sudden COVID took a back seat. It was almost like there wasn't a pandemic anymore. Are we out of it? What really should happen? We thought that for today's show, we're going to get one of the most qualified minds in Nigeria. Oftentimes, we don't realize that there are bodies and organizations and institutions in Nigeria that are doing quiet work, and we don't know who is behind them. That's why one of the guests today is Professor Ikpi Braide. Professor Braide is incredibly, you meet her later, accomplished. And she's the acting president of the Nigerian Academy of Science. Yep. And we want to talk with her today about the whole history of pandemic, where Nigeria should go from now in terms of public health and preventing future outbreaks. Actually, what's still going to happen concerning COVID. We'll have that conversation with Professor Braide when she joins us. Also, I'll be having two more conversations, one with Ms. Buki Williams, who is going to be talking about just the whole idea of young people and violence, because there's violence on one level against women, which is big and nuanced, and then there's of course another level of violence generally against young and poor people in Nigeria. Finally, we'll also be talking to I haven't seen her in a long time. I look forward to seeing almost everybody, but for Fuluke, I also look forward to seeing because I haven't seen her in a really long time. She is an actress, a well-known actress in Nollywood. But also, for years ago, she was one of the first people publicly to come out and talk about having been sexually assaulted. And I remember how difficult that was for her at the time. And she also has a foundation working in that area. And we'll be talking with her later on. We've got her.
Hello.
Hello, Professor. Good evening, ma'am.
Good evening. Good evening, Funmi.
It's
Good
so
evening.
good to see you.
Well, it's nice to be here.
I thank you for making out the time to join us. I know that this is not your usual thing, and to do it so late in the day, I'm really grateful.
Thank you.
Your video is freezing a bit on my end, but I hope it's not freezing on any other end. But I can see you clearly. I'm sorry to
I can see you clearly.
Okay,
good. I can see you clearly, yes.
Prof, the first thing I wanted to ask is, what has happened to COVID? The whole world is on the street. It seems like a large portion of the world is on the street protesting against racial violence and police brutality in several parts of the world, including Nigeria. People are wearing masks, but what's happened? Has COVID gone? Was COVID, was the lockdown, was the lockdown an overreaction in the first instance? What's your
I
own
should
problem?
ask you. I don't know what has happened. I don't really know. People need to be more careful. They need to observe social distancing, but we can see when emotions take over, then they forget about the social distancing.
Well, Prof, do you have concerns that we might have a spike in the next few weeks following the riots around the world?
Well, I think so. I strongly think so. I think there might be some spikes in some places where social distancing was not maintained. We didn't have riots and demonstrations in Nigeria. In most of the communities, there's not really much social distancing because of the way we live, Africans. We have all these mandatory cultural meetings and celebration ceremonies, so which makes it difficult to observe that aspect of non-pharmaceutical interventions.
Yeah, but even without that, Prof, most of the states are going to ease lockdown and people are going to return to work from next week. Churches are going to be able to open up again. Is it premature or was it actually never really a big deal for Nigeria in the first place?
Well, when we locked down, what happened? There was a lot of disobedience. So I don't think it will be quite different from now when there's relaxation of the lockdown. But I think the most important thing is observing all the preventive measures as a block together. Face masks, hand washing, social distancing, and other preventive measures.
I must ask this question though, Professor, did we need the lockdown in Nigeria? I mean, considering the effect on the economy,
Um,
did we need it in the first instance?
we needed it. We needed it, particularly with the interstate borders and international borders, because it was originally an imported disease, but we're now seeing community transmission. If we did
Right.
it earlier on, lock the borders, international and national, the spread might have been controlled.
What happened? There
But
was so
it's not
many.
all. We are still on the right track, Funmi.
Right. Right.
Yes.
But there were lots of doomsday projections for Africa, especially Nigeria, which has not come to pass. Why do you suppose that is
Yes.
so? That the doomsday
That
did
it
not come?
hasn't come to. What was the doomsday prediction that so many people would die?
Yes,
It
that,
hasn't come to
that Nigeria
pass.
will
You
lose
know,
millions and
this,
millions of people.
yeah, people are still studying why. People are still studying why. Researchers are still working on why. Why hasn't it come to pass? Is it as a result of some medications we're taking for some of our horrible tropical diseases, or just why? People are still studying. We can't
Right.
tell now, but it hasn't happened, thank God.
But then the question is about our primary health care generally and public health care really. I've read your paper, which I found really helpful and insightful about parasites. I love the topic parasites, poverty, and politics. Where you made the really strong link between
Yes.
between I mean like the heart of everything at the end of the day is poverty and access of the majority of people to good health care. And there was a statement that I found really very, very helpful where you mentioned that if the death or the fatality of the poor is not linked to people whose death matter more. That's people who are higher up in the power and money
Okay.
hierarchy.
That
They
was
usually get a
a
lot of
Paul Furman's statement.
yes. You put
Paul
it was
Furman.
more
He said that
yes.
the best place for a disease to hide is among the poor. Only a handful of infectious diseases cause much morbidity and mortality in Africa. We all know that. And these include simple things like malaria, diarrheal diseases, respiratory tract diseases, neglected tropical diseases, and others. And these are the killers of the poor. Yeah, these are the killers of the poor. Those forgotten people you were talking about. forgotten people in forgotten areas. And disease and poverty seem to have a cyclical relationship. You know, when you are ill, you are poorer. When you are poorer, you can't take care of your health. So it's a cyclical, very negative cyclical relationship. And it takes strong political will to, first of all, think about the poor. Think about the poor. And secondly, to spend on preventive interventions that may not be visible. You know, it's more common now that people like to build health centers and other facilities, even if they are not stocked, because that attracts a lot of applause from the public. But it's much better to prevent than to cure. Because if you look at sometime in the past in Europe, they had a lot of problems on some health issues that were related to sanitation, you know, water and sanitation. There were so many health problems. Improvement in sanitation, just simple improvement in sanitation, solve the problem, which means that it is cost effective to spend on interventions that will prevent exposure than to spend on stopping people from dying. You know, if you look at a continuum, you have health on one end, you have death on the other end. In the middle, you have exposure. So a lot of spending now is on preventing people from dying, whereas could have spent more on preventing the exposure that will lead to people to die. And that's much cheaper, right? Because spending on preventing people to die will mean a lot of expenditure, and it's a lot. It depends on political will.
So, Prof, you were talking about the political will to do the right thing. Primary healthcare. I know that Professor Olikoye, when he was Minister for Health, prioritized primary health care, and that was what he wanted to focus on. Because what you have spoken about now seems to be most of our issues in public health are sanitary issues. So if we had water supply, for example, what will make a difference, really?
First and foremost, that primary health care is not as it should be. COVID-19 has thrown up many inadequacies in our health system. One of it is primary health care. 42 years ago, after Alma Ata declaration, there's yet to be accessible and affordable health care for all. So there hasn't been health care coverage for all 42 years after the declaration. Because now you have healthcare workers concentrated in the cities. You have secondary and tertiary health facilities still treating patients with health problems that could be handled at the primary level. And a lot is happening during this COVID-19 pandemic. I think after the pandemic, we are going to see a revitalized primary healthcare to some extent, not totally. Then the poor will have easier access to healthcare, and communities will be more involved in taking decisions about their health. And of course, there will be better trained health workers that time. And hopefully, I think we would have achieved. We will move closer to achieving achieving the Sustainable Development Goal 3, which says ensure healthy lives and promote well-being for all at all ages. And then universal health will not be far from us. That is leaving no one behind. Everybody will have access to health care.
Prof, was it better in the past than it is now? I mean, because I can't challenge you.
I think it was better in the past than it is now. But remember that the population has grown. And in the past, we had, I think, a more functional health system. I don't know why, but I think it's related to the budgeting of health and the political will, because the budgeting is not adequate. Nigeria signed for 15% GDP. of the GDP to health. But up till now, we are at around 4 point something percent.
What are the things that we should be looking out to see from political leadership that would tell us that public health is being prioritized?
Is it after COVID-19? Because right now, all money is going to COVID-19.
Yeah.
After COVID-19.
After
Well,
COVID-19.
It may sound ridiculous, but I feel that if we have the basic facilities and services in place, the health of the people will be better. You know,
Right.
to us laymen, health is absence of disease. The human rights people say health is a human right. All right. WHO
Yes.
says health is a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. But you know, there's a social definition of health, which is that health is a result of interactions of variables such as nutrition, housing, education, water, income, environment, transportation, and access to health facilities. So if all these variables are taken care of, then the health of the people will be better. For instance, in Lagos State, if you have cholera, and you continue treating the cholera, give ORT, give all kinds of things, and you don't solve the problem of water, you will continue having cholera forever. Another
Yes.
example is malaria. All the drains, the dirty drains where mosquitoes breed, if those drains are not evacuated, and if people don't change their attitude to waste disposal and environmental sanitation, then malaria will be there forever.
So we're talking public water works, we're
Public
talking
water
refuse
works,
management, we're talking, job
drainage, clearing of drainages. I've seen drainages full of pure, pure water sachets and bottles and things.
yes.
That's a correct breathing site for malaria
I mean,
carrying mosquitoes.
some of these things seem so
That
we
would be
shouldn't
the
even be
first
talking
thing to
about
do.
them now.
That would be the first thing to do. So that will take off a lot of morbidity. If you do that generally nationwide, it will take off a lot of morbidity. I wish the political leaders would just one day say that all their political appointees should go and provide their communities with potable water, give them adequate coverage. That will solve like a huge percentage of the health problems because so many are water related and
Yeah.
sanitation related and hygiene education related.
I want to move on quickly because, of course, we're having problems with the internet, so I don't want to keep you for too long. But I wanted to quickly go to the issue of women because when we're talking about poverty, of course, you naturally talk about women because women disproportionately are more likely to be poorer than men are. And this has a lot of ramification. What the question I wanted to ask you quickly before you go is that what happened? It seemed that your generation of women had it better than our generation are having it, and then younger generation after me are having it. Is it getting worse or better for women in Nigeria? What's going on?
I think it's not getting better because we have derailed. National Council of Women's Societies was founded in 1959. It was a national grassroots organization, non-political, non-governmental. It was an effective organization as long as it stuck to its mandate, and it was composed of a network of women organizations in Nigeria. So we had representatives from the community up to local government and then to the state and so on. But right now, I don't know what has happened to that society. It's no longer non-political. And I don't know I don't know the status now, but nothing much has happened. I think we should just advocate for equal opportunities, not 30% or 35%. Equal opportunities. So if you ask for 30%, what if you ask for equal opportunities? If it's suitable for a man, he takes it. If it's suitable for women, they take it. So just asking for percent is like an insult. We should be asking for equal opportunities, men, women, equal, so that if a woman is fit for a post, he takes it. If a man is fit for a post, he takes it. And it will be better than just gathering on every Women's Day to just do rally and shout sterile slogans all over the place.
All right. Well, Professor, thank you for this time, for throwing light to this conversation.